Now we'll look at another bone and also talk about the reasons why we study this bone. And this is the mandible, forming like the lower side of the mouth. Okay, the mandible. So the mandible could be affected by what? Temporomandibular junction, disorders, joint, disorders, mandibular fractures, and dental relevance. Because if you want to do any surgeries to the teeth, it's always good that you have a good knowledge of the mandible bone. So it's the largest and strongest facial bone. It's very important for you to be able to chew, for you to be able to talk, and how your face looks like depends on this bone. So for the TMJ disorders, we saw that definition. Any dysfunction of the temporomandibular joint where the mandible articulates with the temporal bone here. This place, the temporomandibular junction. So these dysfunctions there could actually cause a lot of pain in your jaw. You have clicking sensations, you have locking sensations. There's difficulties of you opening or closing your mouth. You have associated headache or ear pain. Okay, so it can affect how you chew something, how you speak. I had one issue like that. I was able to open my mouth. I'll do like, if I want to open my mouth, I have to do like this. If I put small bread, I wasn't able to eat solid food for like a week. The mandibular fractures, you can have fractures there where there's breaks in the mandible. Okay, it's very common in high, all those traumas to the face, road traffic accidents, assaults, sports injuries. Clinical features, a lot of pain there, swellings, malocclusion. Okay, the way your teeth are aligned, the down and the up will not be proper again. Also numbness if the alveolar nerve is affected. So moving, we have dental relevance where there's role of the mandible. It houses the lower teeth. Do you understand? So it provides attachment for muscles for chewing. So if there's any surgeries that you are doing around that side for teeth, you have to have good knowledge of what the mandible is. So pathologies like cysts, tumors, osteomyelitis often affect the mandible, and the inferior alveolar nerve could actually be affected too. You understand? So that's what we have for the importance of this bone and why we study this bone.